I started to have like this feeling like things were getting stuck in my throat, my chest. And I just thought it was like this weird thing that was happening. I didn't really understand it, but it would like interrupt meals to the point that I would be trying to get it out by like vomiting for hours. And I just thought that was just my life. And then I started talking to my aunt about how I've been having this issue. And she's like, I have this condition called EoE, and it's genetic. You should probably go talk to a doctor.
Hey, how are you?
Good.
Eosinophilic esophagitis, or otherwise known as EoE, is a disease of the esophagus where you get inflammation that leads to what patients feel as either food sticking or trouble swallowing. Because you're having this trouble swallowing, it can lead to choking episodes, and it's very uncomfortable for the patient and can be a true medical emergency.
I generally start to notice it when I'm eating too quickly, and I feel like a tightness in my chest, like I can't swallow. And it's not generally like up here, it's gonna be, for me at least, it's in my chest, and like I can feel the food getting stuck. It's very uncomfortable. So I made an appointment with the GI doctor to do a scope. And after he took some biopsies and realized, yeah, that's what it looks like, and then referred me to an allergist.
Originally for Lindsay, she had a scope done, which was when they started her on the proton pump inhibitor and also tried some of the topical corticosteroids without much success.
They gave me 3 treatment options, essentially. The inhaler with the dry swallows, or the proton pump inhibitor, or the biologic. I really didn't want to try the injection right away if I didn't have to, so I did the proton pump inhibitor. The proton pump inhibitor was just a pill. It essentially just, from my understanding, would settle the acid in my body to try to get rid of anything that was causing the inflammation. So I would take that daily. So I did that for 3 months and then did the scope, and it revealed that there was nothing. There was no improvement. It essentially was doing nothing. Actually, the GI doctor said he's seen a lot of improvement in other patients with the biologic. So he's like, maybe bring that up to your doctor as well and see. So after meeting with her and kind of talking over the options, we decided to try this and see if the biologic would help improve the symptoms, because the other ones weren't working.
She had already come to me having tried several therapies. So we kind of knew which direction we were going to go in already when she came in on the first visit. So we decided to go ahead and start a biologic.
And I've definitely seen an improvement. I've only been on it for about a month, but I haven't felt that tightness in my chest like I had before.
I think when you talk to a patient, you really want to know like what their goal is. And for Lindsay, I think a huge goal was, I don't want to feel this sticking anymore. I want to be able to go out with my friends, because that's a large part of our social structure. Going out to eat or having meals together with friends and with family. So her now, with the biologic, having no episodes of sticking since she started the biologic, has been a huge win for her.
Since I've had the diagnosis and the treatment, I feel like a weight has been lifted off my shoulders a little bit, because I had this issue that I didn't understand what was going on. I thought that this was just how it was going to be for the rest of my life. So knowing that it's something that is real and can be treated, it's a good thing.
We're kind of at the start of our medical journey with EoE. I feel that it's a true partnership between the patient and the rest of the care team, whether that be dietitians, psychologists, whoever's involved in your care, and recognizing that partnership between the patient and the care team is incredibly important. So as a patient, my advice would be, please don't worry. We know that this is difficult. We want you to come to us and talk to us about all of your concerns. And there is so much more that's available now than was 10 years ago. There's going to be even more available 10 years from now. There's so much hope, there's so much more on the horizon, and we can't wait to partner with you and help treat you.